In clinical medicine, some of the most devastating emergencies do not announce themselves with pain. They arrive quietly, silently, and by the time they are recognized, the damage has already begun. This is the reality of stroke, a medical emergency that affects the brain, the control center of the human body, and one of the leading causes of death and long-term disability worldwide. Today, we are breaking down what a stroke really is, why it happens, how to recognize it early, and how modern medicine fights back. Because when it comes to stroke, time is not a suggestion, it is survival. A stroke occurs when blood flow to part of the brain is suddenly interrupted. The brain depends on a constant supply of oxygen and glucose. When that supply stops, brain cells begin to malfunction within seconds and die within minutes. And like many organs, the brain cannot store oxygen once brain cells are lost. This is why stroke is so dangerous. It is not just a blockage or a bleed. It is a race against irreversible brain injury. In medicine, we classify stroke into two major categories. The first is ischemic stroke. This is the most common type, accounting for about 85% of all strokes. It occurs when a blood vessel supplying the brain becomes blocked, usually by a blood clot. When blood cannot reach brain tissue, neurons begin to suffocate. The second type is hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures and bleeds. The bleeding increases pressure inside the skull, compressing brain tissue and disrupting vital pathways. Although less common, hemorrhagic strokes often carry a higher risk of death. What makes stroke uniquely terrifying is how suddenly it alters function. Depending on the area of the brain affected, a stroke can cause loss of speech, loss of vision, loss of movement, loss of memory, loss of personality. A single event can permanently change how a person relates, works, and communicates. In many cases, the person experiencing a stroke does not realize what is happening. This is why early warning signs matter. In emergency medicine, we use a simple tool called FAST. F for face. Ask the person to smile. Does one side drop? A for arms. Ask them to raise both arms. Does one drip downward? S for speech. Is their speech slurred, confused, or absent? T for time. If any of these are present, time is critical. Call emergency services immediately. Other warning signs may include sudden numbness, severe headache, loss of balance, blurred or double vision, sudden confusion. These signs should never be ignored. Stroke does not happen randomly. Major risk factors include high blood pressure, diabetes, smoking, high cholesterol, obesity, heart disease, irregular heart rhythms. Age increases risk, but stroke can occur in young adults and even children. When a patient arrives at the hospital with suspected stroke, every second counts. Doctors perform neurological examinations, blood tests, and urgent brain imaging. CT scans help rule out bleeding. MRI scans show early brain injury. These tools guide life-saving decisions. For ischemic stroke, clot-busting medications may be used, but only within a strict time window. In some cases, specialized procedures physically remove the clot. For hemorrhagic stroke, treatment focuses on stopping the bleeding, reducing brain pressure, and stabilizing the patient. Modern stroke care has dramatically improved survival, but only when patients arrive early. Surviving a stroke is often only the beginning. Recovery may require physiotherapy, speech therapy, and long-term support. Some people recover fully, others live with permanent disability. Early action makes the greatest difference. Stroke does not wait, it does not warn, and it does not forgive delays, but knowledge saves lives. If this video helped you, please share it with someone you care about, someone whose life matters to you. Subscribe to this channel, like this video, and leave a comment below. In the next video, we will dive deeper into stroke prevention and recovery science, because awareness is the first line of defense.